You are listening to An Awakening podcast. This is an adult conversation about local, worldly and otherworldly topics. Be prepared, there is some swearing in the podcast.
Hello everyone, welcome to An Awakening. Tonight we'll have my doctor with us. I know it sounds strange to have your doctor sitting doing a podcast, but I'll tell you how I met this man. I was introduced to him through a very good, someone I really love and admire, and someone's helped me quite a lot over the years. And she told me about him, so I thought, well, she hasn't been wrong in the past, so we'll have a look at this man. So I went to see him, and he put a set of headphones on me, and I'm sitting thinking, what the fuck's going on here? What's happening? And he scanned, he says, I'm scanning you. Here's me, right, fair enough. And at the end of it, he started telling me things about myself that I sort of nearly forgot about, different injuries and stuff over the years. But the last thing he said to me was, I thought you were vegan. I says, I am. He says, but you had a bit of cheese for your breakfast this morning? And I thought, in the name of God. Because that morning when I was leaving, I walking out of the house, there was 2 plates sitting, and I'd had my big lad up for a bit of dinner. And he had taken Parmesan cheese. And that morning before I went to see a doctor, I'd lifted a wee bit off his plate and had it. And that showed up in the scan. So when my big lad's in, I said to him, I was telling him, and he says, girls. I says, I'm telling you. He says, I have to go and see this man. So away he went. And I seen him a couple of days later. And I says, well, did you go and see a doc? He says, aye. He says, he took right enough. He told me all these different things and different, he knew what, what I was doing and what, about me. But at the end of it, he says, and your Achilles? And he says, I says to him, doctor's not wrong with my Achilles. He says, that night I was in the gym, my Achilles went. So, here's me, right, this guy's real, let's have a good time. So I got to know him, we met and we talked and we went in for different things. And I've sent quite a few people to him, and everybody's over the moon. They really are. His whole approach is different. He's a holistic doctor. And today, the way we were living with all these pharmaceuticals and all, to me it was a breath of fresh air. Yeah, I don't know about anybody else, but when I go to a doctor's and he hands me a prescription, I usually just throw it in the bin. What use is that to me? So I'm going to do is just let the man introduce himself. His name is Dr. Modestas Jarutis. Is that right?
Yes.
Did I get it close? Yeah.
Yes, perfect, Tom.
Brilliant. Better make it right. Hands on. Do you know what I'd love to know? If I was living, where are you from?
Lithuania.
And I was thinking, I'll go and move somewhere. I'd have moved somewhere warm. What on earth brought you here? And what? Tell us about your journey.
Yeah, Lithuania is in our language. It's Lithuanian language. It's Lietuva, and it means land of rain.
Oh, cool.
And when we landed in Belfast in 2005, we found another one, land of rain.
Yeah, I'm home.
So exactly, it's like landing, in beautiful Green Island with very similar climate, except that winters are not as harsh.
Sorry, winter's not harsh here?
Yes,
all right.
Because in Lithuania we sometimes get to minus 20 or even lower. But this winter was nearly no snow, so obviously climate is changing. And my whole journey started as a medical doctor. I trained as a general surgeon, then finished my special training in vascular surgery. And I did a lot of surgeries as a vascular surgeon in Lithuania. And then I got my kind of all documents and everything transferred to UK. I got my GMC license and I worked in NHS for 5 years as a general/vascular surgeon in different hospitals. And during that time as a surgeon, I realized that more and more patients are getting better without necessarily modern medicine.
Intervention?
Or without intervention. I had so many patients who needed bypass for blocked artery in the leg, which was, really cold and painful. And by changing lifestyle, by stopping eating, sweet stuff and meat, adding 1 or 2 minerals and vitamins, they got microcirculation back, that they even didn't need any surgery.
Yeah.
So this convinced me that surgery is not necessarily first option for someone who has poor circulation. So little by little in my personal journey and through raising my kids and, my dad's kind of health issues, I realized that alternative methods really work, and I got involved more and more. And even in Lithuania, when I was practicing as a surgeon, I was using acupuncture, homeopathy, herbal treatments, because they are proven to be very effective, especially for microcirculation, for issues with, cold feet, cold arms, Raynaud's syndrome, and vertigo, all what's connected to the poor microcirculation. So in a lot of cases, the alternative methods or herbal treatments or homeopathy, they were even more successful than modern, chemical treatments. So I was always keen to combine all available knowledge, and that's how eventually I decided that I need to find the best combination for each patient, what particular that patient might benefit most. And because we have more and more advanced technologies like bioresonance, cold lasers, technology that allows us now to do testing without any harmful side effects, you can see dysfunctions. And modern medicine is amazing by fixing something that's anatomically not right. Like if, you broke the leg, you need to go to hospital, that needs to be fixed. But modern medicine is not great in fixing dysfunction. Like when something is not functioning, modern medicine can offer, a tablet that will help that function to keep going. But eventually you will need either stronger tablet or another tablet or combination of 2 or 3. And eventually patient ends with a bunch of bag of the tablets and they still don't feel great.
I personally was at a business one time in Thailand. I had occasion to be at this hospital called Bumrungarh in Sukhumvit Road, Thailand. It's the most impressive hospital I've ever seen in my life. Everybody thinks, Far East, not at all. My God, it's like Las Vegas. They want to see these hospitals. But on many occasions I was and then I ended up out for a smoke and talking to people. And the amount of people that I'm talking about British people, and Irish, that I went there and found out that maybe been on so many medications, and I walked out with none. I heard that you don't need this because you need that to cover that. And that. Is that what you're finding here?
Exactly. Exactly.
Just, my mother now, I think she was on 20 odd different medications. I swear to God, she nearly rattled when she was walking up the stairs. It was shocking. And it took her, because she was so old and so feeble, it took her so long to get her just her medication every day. And a lot of it she wasn't needing. Is this what you're finding?
Yes. It's modern medicine approach is, okay, you got a symptom, we have a tablet for that. And sometimes it's necessary. And if someone is in a pain or something happened in life and, that tablet for some time makes sense. Yeah. Because if you are in pain, you can't physically start healing. So everyone knows if heart attack starts, you need to calm down the pain, first of all, to allow patient to relax muscle, to relax arteries, to improve microcirculation, that part of the heart that's dying starts reperfused, and the kind of life can continue. So pain management is very important, but you can do pain management with acupuncture, which even by NHS is becoming more and more accepted, and pain clinics, they all offer now acupuncture as a normal. So the key point is that when someone starts patient on a tablet, nobody raises a question actually for how long I need that. And nobody is advising or even asking. Everyone is afraid to stop that tablet because what will happen with that patient? Exactly. And that's becoming, so if someone started someone on a tablet 10 years ago, most likely that patient is continuing, and nobody's asking question, does that patient still needs that? And if patient comes with a different symptom, they will give another tablet. And by, you get to 60, 70 years old, you can be on 20 tablets.
I should be on quite a few myself, but I just refuse to take them, especially since I met you, because I've seen alternative ways of fixing things. I remember one day I was very, very stressed out and was all over the place, didn't know where I was. I went to you and you advised me to go down and get into the sea. It was October.
Yes.
For God's sake. But it worked. It does. It resets your clock. It's the first time I went to the doctor and got a prescription to go and jump in the sea. You know what I mean? But it did. It works, But, if I went to a doctor, I'd end up with a prescription,
Exactly.
a GP.
Exactly.
And I just think that I can't blame the doctors because, you go to the doctor and you've got 11 minutes.
Yes.
And he's listening to everybody's grief over him 11 minutes. And I'm sure it's not too pleasant for doctors to listen to some people,
It's difficult. And, it's very unfair that especially GPs are under huge stress to make quick decisions because
suicide rates are the roof with GPs.
And they have limited time quickly to help that patient.
Yeah.
And, system is overstretched and, everyone is trying the best, but there is to get to the core issue, why this started, when it started, what happened in the patient's life, you need time. Therefore, each consultation lasts at least 1 hour.
Yeah.
Because, when you are trying to figure out what happened with a patient 10, 20, or 30 years ago, or sometimes even 50 years ago, it takes time for patient to remember and to guide him to think about events, about people that surrounded that person when first symptoms started.
Yeah.
Because that's most important from Ayurvedic medicine point, even traditional Chinese medicine point, which I'm applying more and more in my practice.
Yeah.
Because anything we do now really, even from modern medicine perspective or alternative medicine perspective, helps. But that is not fixing. That's not healing. If you want to heal someone, to physically get rid of that condition, whatever it is, you need to go back when it started and figure out the people, events that surrounded you at that time and what feelings, what emotions you swallowed, what patient didn't express and took inside and never said anything. And that looks like is one of the most common now dominators that causes one another disease to come up, 6 months later, 1 year later.
Yeah.
So I'm finding this really fascinating because there are so many therapies, that can be used like hypnotherapy, going back in time, doing regression session to figure out in subconscious level which event actually triggered that, and it's becoming more and popular in Belfast as well. And that is again safe way of figuring out physically what caused, that disease or that symptom to start.
Yeah, I found myself that the way I look at things, I love gardening and I love plants and all that, right? Now, if one of my plants isn't too good, I don't stick a plaster on the leaf or over the flower. I look what I'm feeding it. I look how I'm keeping it, how it's being husbandried, how I'm being looked after. Go to the root cause. That seems to be what would
Yes.
that be an analogy of what you are doing?
Yes.
That's the way I look at it.
And, being a surgeon, I was crazy busy in a hospital, a lot of hours, a lot of stress, and my health was not great. And when I fixed myself with fasting, proper food, avoiding sugar and carbs as much as I can, going and resetting myself once a week in the cold water, I started doing all these things myself and applied on my family, on my friends. And by seeing results on myself, I started advising for my patients to try as well.
Yeah.
So you're absolutely right. It's, we are what we eat, and cleaner products we eat, more naturally we eat, naturally I mean once a day, because it's crazy. We were told so many years that breakfast is the best meal of the day, but it apparently, was a big lie. And nobody in the wild, if you look into wild animal kingdom, would eat a breakfast because we are still digesting dinner. So all these things eventually, they are now, because of internet and people looking for truth, you can see that more and more people are moving towards, 1 or 2 meals per day instead of 4 or 5 meals per day. So, and my point is, when I am talking to patients, I'm saying, just try. I'm not asking you to try another tablet. I'm just asking, try not to eat breakfast. Then try not to eat lunch as well and see how it goes. Even now, one of the most popular British diets, 5-2 diet. 2 days in a row, Mike Mosley advises you to eat only one small dinner. So it's the same rule that you don't eat breakfast and you don't eat lunch.
And fasting, you mentioned fasting. I do, I did. I haven't done any for a while. I've been very lazy. But I done quite a bit of fasting. And I just felt wonderful. I mean,
exactly
what it does, I think, to be honest, we eat too much.
Yes.
And the amount of obesity about at the minute with young kids and all is unbelievable.
It's more and more science. Real clinical trials are showing that we don't need as much food as we were pre-programmed. We were told that we need to snack. We were told that we need 4 or 5 meals a day because that is money. Someone benefits from that.
Eggs, milk, whatever.
Exactly. If you stop eating, you are worst customer. And because I am from Lithuania and in my trainings I had a huge Russian influence, Russians are great in fasting. So, and everyone knows every religion has a fasting as part of that. So it was, I think, one of the oldest ways of fixing the gut problems. Russians, by accident, they found that if you fast for 7 days, people who have mental diseases and schizophrenia, for example, it goes completely away.
Oh my God.
After 7 days of full water fast, schizophrenia is completely gone. Unfortunately, it's not forever, but these patients usually need to do 7 days fast once a month when they don't need any medication to get completely proper brain function back. And all these documentaries are free and available on YouTube, So if you just put into...
but listen, with every bloody thing in the world in their fingertips, on the internet, and yet people are slick as champ. People don't seem to be getting the message. When you go into the stores at the minute, they're empty. Look what they're empty of.
Food.
But it's shit.
Exactly.
It's like, I don't call that food. Now this is just me, and I'm not being picky or anything, but when I was up seeing the surgeon, I have cancers, and when I was up seeing the surgeon, he had absolutely no idea about food, about nutrition, about anything like that. And to me, that's how you're built. That's what you're made of. And yet the guys advising me he had no training. I asked him, and he'd done 1 day's training on nutrition. And I'm sorry, that's not bloody good enough. And it isn't, where yourself, you look at the root causes of things, and when you can look for different foods or different
yes,
things
exactly. Different combinations. Exactly. And every person is different. And, more and more science shows that we can't apply the same algorithms or the same rules for all patients. There is no such thing as good diet for everyone. You need to be sensible. You need to try something, stick with it for a week or 2, see is that makes you feeling better? Do you have more energy? If not, you need to try something else. But you need to do a little your own investigation. If you're not trying, if you're not, commit to something doing yourself, it's very silly to expect that a tablet or procedure or something will heal you. The tablet procedure, something can help you to feel better for some time, but that will not heal you. Because if you want to get your completely body function back to normal, you need to do something yourself. You need to commit to the process. And my most, brilliant cases, life-changing cases where patients actually believed in what I'm saying, and they tried different diets until they find one which suits them. Most simple one is blood type diet. We have different blood types, and different blood types can eat better some foods than others. And this information is very available, becoming more and more popular. You don't need to follow any regime. It's just, if you A group blood type, you're not supposed to eat meat. And most of people who have A blood type, they don't feel like eating meat. They naturally are more prone to be vegetarians or vegans because they don't have specific, enzymes and blood.
Proper enzymes.
Exactly. And Dr. D. Damo, who was, one of the first who introduced that idea, all information is for free on websites and everything. And if you ask here, very few patients knows the blood type. So my point is,
I think you're charged now to get your blood type from you want it from a doctor.
Yes, but if you go to blood transfusion center and if you decide to donate your blood, they will check it and you will.
And sneaky one. I like sneaky ones.
Exactly, and donating blood, and it's one of the oldest another treatments. Amazing for high blood pressure. Amazing for anxiety.
What is?
Donating? Yeah, give your blood.
Exactly.
Yes, exactly. Because you need to let little of they call mad blood.
We're getting leeches out next.
Which is...
Will it work?
Yeah, exactly. And leeches are very, very popular in alternative world, So not maybe so much popular in UK, but in East...
We're looking at it worldwide.
Exactly. In East, for...
Sticking a septic finger or whatever.
Exactly. So my point is that through my career as a surgeon and as a holistic doctor, I've seen so many miracles and real healings, and some of them being just by patient really believing in God, in a doctor, in a family member, or, understanding enough is enough. I really need to do something, because every disease, every symptom is just a sign that patient needs something to change.
Do you know, I've found that there's some people they'll go on medication or something will happen to them or whatever, and they just give up. They say, oh, that's me. I'll take these tablets. I'll take them other tablets. And it's as if the knowledge of them getting ill and the knowledge of them that they have to take whatever medication, they just lose heart. Do you find that? Or?
Life is tough, and if it hits you at the time when you don't have enough energy, when something happened in your life, maybe a close friend died, or mom or dad, or you went through divorce, you don't feel like ready for fight or ready for life change.
Your head's
and
down.
Exactly, you're not in the right space in the right time. And modern medicine says, okay, here is a tablet. And tablets, for anxiety, for depression, for any condition, they numb you. And
I was looking at a report about serotonin, that when you take antidepressants, it actually reduces your serotonin levels forever. After that.
Yeah, but the key point is that they found whatever way, and there are different antidepressants working through different mechanisms. Initially, they work, and the people feel a little bit better. They feel a little bit more balanced for that time, but eventually that effect wears off, and either they need a different one or stronger one. And everyone understands that, I can't live like that forever. Sometimes when really hard times comes, you need some support. And, modern medicine can offer that help for some time. But that's only for time for you to get your things together, look what you can do, what you need to change, go and talk to, any physician who is thinking holistically or functionally, why you got to this place in first place, and what changes are most important to start to get back on track, back to health. Because body don't want any chemical.
No, absolutely.
Body wants to be healthy and happy, and when we sleep, tries to fix everything.
Yeah.
But if sleep is not right, if person can't get proper sleep, there is no more time to get anything broken fixed.
Yeah.
If you're eating too often, too much, there is no time for body to fix anything. Body is just digesting.
Correct me if I'm wrong, but I had this discussion with a surgeon, and what I was basically saying was that he was pushing me to eat meat, to go on protein. I said, but doc, I don't need protein.
No.
He says, but everybody needs protein. I says, no, I don't need protein. He says, how do you work that out? I says, well, I'm 98 point whatever the same percentage as a great ape. And a great ape doesn't eat nothing. Well, maybe eats the odd insect or something, but he's totally, vegetarian. And he had pound for pound the strongest land animal in the world. An elephant's no mug. And there's a rhino. None of these animals only eat. And my explanation to him was that it takes so many hours for my body to break that protein down into an amino acid so that my body can use it. Where if I eat a piece of fruit, it's amino acid right away. It means all my antibodies now are doing other things.
Exactly.
Am I right on that? Or?
Yes. So, the meat, of course, and protein can be found in different versions. And I think, some people, and again, we were pre-programmed, and, that with all fast foods and restaurants serving you steaks and,
chicken.
Yeah. So kind of it looked like if you have a steak or burger or, something really meaty, it's a man thing, it's man
meat
food,
food,
it's man food,
Absolutely.
If you just nibbling, chickpeas or, it's a woman food, So all these pre-programming was happening for years and years.
Yeah.
And it's difficult to say, okay, I will not do that unless someone is raised in a family who were vegetarian or vegan, or someone at some point in life understands that actually you kill someone, another live creature, live animal to fill your tummy, and there are so many different, plant-based foods that contain enough protein.
Oh, yeah.
The same peas protein, is now one of the most used in gyms as alternative, So the industry moved so much that you can get as much, if you really need protein, you don't need animal protein, So if for some reason your body really feels better, stronger on protein, you can get plant-based protein. So you don't need to kill animal to get protein in you.
Yeah, and it's not just we're killing animals. It's that we're killing animals, and people are eating animals, and they don't know what the animals are being fed on. I had a discussion with a woman a couple of years ago, and she's actually a pig farmer, and she had cancer, and we were chatting on him, and she says, "What do you think?" She says, "Everybody has cancer. It is cancer. It's rife. It's everywhere." And she says, "What do you think is cancer?" I said, "Well, what are you feeding your pigs?" And she looked at me. She didn't know. Because we're bringing in food from China. Well, who the fuck is going to buy anything from China? I'm sorry, in the name of God. And, they're important. Oh, here's another thing. Just as we said, I found out some figures the other night about China. That 65% of all pharmaceuticals that goes through the health system in America, through doctors and clinics, everything else, 65% of all their pharmaceuticals are actually made in China.
Yeah.
And I love this one. 95% of all the ingredients that the pharmaceutical companies in America use to make their stuff, the ingredients come from China. you know.
Yeah, it's
And you know, I'm not knocking Chinese. You know, I'm not. I have a wee friend, she's a acupuncturist in the Belmont Road. Dr. Chen, everybody, she's brilliant. But 31 Belmont Road. There is an issue with China. We're going on to coronavirus, are we?
eventually.
A wee segue into that one. And, well, it just seems to that's the whole thing at the minute. You know, we're you know, not this will be going out shortly, but we're sitting in the middle of this. They're called a pandemic and all. What is your thoughts on this coronavirus? What is your gut feeling or your intellectual?
Yes, as a dad and, you know, as a son, you know, I have my parents who are already in, you know, 76 and 77, and I'm worried, you know, because coronavirus is really harsh on elderly and the people who have compromised immune system, and it's even harsher than simple flu. It is another virus that is now going around the world, and we don't have yet immune system, you know, antibodies against that. So eventually, most likely, we will have this another flu-like or kind of outbreaks around the world, the same as we have a flu outbreaks every winter. So we survived flu season. Now we have coronavirus season. And hopefully that will last 2 or 3 months and it will go away. And in that time, you know, 50 or 60% of people will get natural immune response, because this virus is not necessarily completely fresh. You know, coronavirus types are already known for a few years. You know, it's not like born in December 2019. So a lot of symptoms that coronavirus causes looks like just another flu. And a lot of people now, they are joking, most likely they say, I think my flu this year was actually coronavirus, you know, attack. So I'm waiting for medical kind of modern medicine side to announce that they will have a test to check and to confirm people who already developed, you know, antibodies against that. So it means if you can take a blood sample and check and see that your immune system already dealt with that, that's you're done. You know, so it means this season is over and you don't need to be afraid of anyone who sneezes or coughs, because most likely you had a light version of that and your body, your immune system met that virus, developed, you know, antibodies against that, and that's it. You know.
You mean, are you Johnson, Boris Bozo Johnson? He's been talking about this herd immunity. Is it?
Yeah.
Do you think it's an idea? Is it a
goer? It is one of the ways. You know, one way is just let it go through, and everyone, you know, not everyone, maybe 70 or 60% of population will get to meet with it and develop its own immunity. Of course, through that process, there will be casualties, the same as every year happens with flu.
Well, I was just looking at figures, you know, for flu. Last year, the worldwide figures for deaths from ordinary flu was 650,000.
Yes, it's...
Now, like, I don't understand, you know, that at the minute there's only been 3,000 deaths in Italy, right? But 2 years ago, there was 68,000 deaths in Italy from the flu. Why are we panicking over 3,000? You know, there's been, and 79, the Italy figures I was looking up this morning, nearly 80% of them had high blood pressure problems.
Yes.
17 people were under 50, but all had underlying problems. In most cases, 2 underlying problems. And to me, figures don't match up. The sums don't work. You know what I mean? Because why are we panicking about this when there's been relatively so few people died, as in comparison to last year, when there was absolutely no panic? The shops, everything was going normally. Why do you think it's all closed down this time? Because even the percentage, the Italy figures, what about the other? Why am I not hearing about the other people that dies in Italy? Only coronavirus. Are they using this in some way? I mean, are they exaggerating the figures? Are the figures being swayed, do you think, for some political reason or for some economical reason?
It's always, I think, something behind. I am always saying, let's wait for another month or two, and we will know a little bit more. Because the whole scary presentation of that is not right. It's not right that, the media is just, instead of educating people and explaining what it is and how to deal with that, it's every day is pushing into face another one died or another 100 died, because if that, you can do the same statistics and the same scary exercise with any condition. If we would push that cancer figures every day, how many patients are dying from cancer, it will look crazy. But because media is not focusing on that, it doesn't feel as bad. And of course, because we don't have yet immune response, because we never met, most of people never met before coronavirus, it could be that it will cause really, more mortality and more people to die compared to flu. If that will be not controlled, if that will be not managed in any way, it could cause, quite a lot of, casualties.
Yeah, but my question is, last year, on the 68,000 deaths, why at some stage did the balloon not go up? Why did it not panic then? And why we're panicking now with 3,000? Like, Italy has a very old population. There's an awful lot of old, they look after
the difference is that when someone gets a flu and the kind of complications from flu comes, most of these people die not at hospital. They can die just simply at home. They don't need hospitalization, ventilation, and of the support from, the ventilation machines. In this case, because the most common complication is very severe pneumonia with respiratory failure or just really, hard breathing, the difficult cases, and a lot of these need ventilation machines. And that overloads modern medicine setting, because we are not ready. These with coronavirus complications, you need maybe 10 times more intensive care beds compared to flu. Because
Why?
Because coronavirus specifically really hits hard on lung tissue, and lung gets really inflamed with a lot of inflammatory water.
Anti-inflammatories don't work themselves.
Yes, and when lungs get inflamed so quickly and so badly, people can't breathe anymore. They really...
Oh, I thought so.
And when that happens, only way to support the patient through that condition is putting onto the ventilation machine. Because patients themselves can't, provide themselves enough oxygen. So, and that is the biggest stretch on the system.
Because it's a stretch because it's not as expensive equipment.
Exactly.
And we don't have that much of it.
Yeah, we have it, but not at the level that is necessary for this complication.
As a doctor, I was reading that doctors in Italy are now not treating people over 80.
Yes.
Because, and they're actually having to call doctors in who may have actually the coronavirus because there's nowhere else to turn.
The key point is that if the doctor...
What is your... If you're an old person sitting in the house tonight, and you're worried, and I'm not talking about, getting your masters, and you're worried about your health, have you any advice for oldies?
You need to keep positive. You need to keep active. You need to do little of stretch, little of, simple sit-ups at home. You can't sit in a corner and get scared and wait when this virus will come through the post box or something. You need to take normal precautions as drink plenty of water, have a good sleep. If you can, take extra vitamin C or at least a slice of lemon. And the fear is one of the most powerful immune system suppressants. So everyone who's already 70 or 80 years old, they understand that yes, they are in that category, that if that they will acquire that virus, it will be tough on them. And you're right, if that patient who gets into respiratory failure and can't breathe anymore normally, of course they need to turn to the hospital, because there is a chance always that there will be a bed available. But if hospital will need to choose between 50 years old and 80 years old, of course they will choose to help 50 years old, because that younger person has more chances to survive and to benefit after that to the community.
It's a hell of a call to make all the same for
it is. It is very crazy, and it's tough on doctors now who are dealing in frontline, with every case. And it's unfortunate that people are not educated on what they can do to improve the immune system, because that is the one that keeps us safe and keeps us going through any infection of virus disease.
So let's just go over who are the main people at risk. Old people, asthma.
Asthma, COPD. And people who have compromised immune system already.
What about overweight people?
Overweight, yes, diabetes, all the chronic conditions, rheumatoid arthritis, multiple sclerosis, all these conditions, Hashimoto thyroiditis, they called autoimmune conditions, where immune system is already distorted for one or another reason and no longer is supporting that patient properly. So all these patients who have autoimmune conditions, other chronic conditions like diabetes, cardiovascular conditions like heart failure, all these are at high risk. And of course for them it's very, very important to reduce as much as possible foods that increase inflammation. So, and most, in my opinion and from my experience and your Tom's, vegan and vegetarian foods now should be, chosen.
The higher vibrations, the higher,
exactly.
energy level.
And less food. So now if we will need to stay in house, if we will have full lockdown, it's amazing opportunity to do a 4, 5, 6, 7 days fast.
But it's also an opportunity when people in the house stocked with grub to sit and stuff their faces.
Yes, and
but through boredom or through.
I know. Okay, let's do 2 or 3 days of overeating and then do a fast.
That's my plan.
Because
3 days eating and half an hour fasting.
No, Tom, no. So everyone bought so many products that they don't need, and a lot of these products will start going out of expiry date. So and
how are they going to eat all them toilet rolls is beyond me.
It's So
it doesn't give you the shits. What is there anything behind all these toilet rolls? Really?
It's it's a fear that when when you see in your toilet, toilet paper is finishing, or last roll, you go and buy next one, and there is no fear, and everyone is fine. Now when they say, you might need to lock yourself down for 2 weeks or maybe 4 weeks, it means what? I will not be able to buy toilet paper.
10,000 rules.
Exactly. And, use a newspaper, like in my childhood we did, So in my grandparents' house, we always needed to cut pieces of newspaper, and
I done the same, yeah. My granny's, yeah. Outside
and nothing
toilet.
happened.
Sometimes you had to break the ice on.
It's just stupidity and fear, that guides people wrong direction. And thankfully, over the social media, you can see people saying, let's stop this, let's be compassionate to each other, and let's just take what we need at this moment and deal with it at a time, because nobody knows what will happen. According to prognosis, the whole virus, casualties, of course, will increase, in another 2-3 weeks. But then after that wave is over, the numbers will start going down. What's already happened in China, so it is natural cycle.
But did you notice it? Did you see the clips of when the officials were walking up through Wuhan and the people were shouting out of the windows at them, "This is all a fake. This is a fake."
Yes.
Why would they do that? I don't think we'll probably ever know the full truth of this, if it came out of a lab, or was it the last SARS vaccination that the Chinese gave out, as it mutated it, or there's all these different things, but
so it's a lot
probably never know.
Exactly, it's a lot of conspiracy theories. And I was reading through one blog actually last night that all these viruses have they are patented.
They are patented, yeah.
So if anything is patented, it's man-made,
Yeah.
So if there is a patent on something, it means it's man-made,
But then again, they've patented all the different tryptamines and stuff in cannabis. Who are they to say,
I know. So
listen, here's something I've noticed. I went for a coffee with a couple of good friends today, and we're sitting talking. And we'll start talking about the good that could come out of this. When you look at the minute, there's dolphins bouncing about in Venice. The water's now turned blue in Venice.
Exactly.
There's full of fish. There's dolphins moving right into the coast of Italy. There's monkeys running all over Thailand. There's wild boars in the streets in Italy. And in Wuhan, people are actually breathing fresh air for the first time in years.
Exactly.
And in different parts of America, you can see the clouds from the cut. I'm sure the flights have cut down everything. It's given the earth a wee bit of a breather.
Exactly.
And at the same time, people are going to start noticing this.
Yeah.
Certainly, and they're going to say, "Listen, I want this all the time. I don't want these places polluted. I don't want my air polluted. I don't want my food polluted, my water."
It
could make people. It could be a great wake up call.
Exactly.
For us all.
It's a wake up call because, it just shows how greedy we are, how unresponsible, and even now through this trouble and so much fear, neighbor actually knocks the door of neighbor, checks how are you. We have a local small kind of neighbor watch community, 200 houses, and everyone now have an older neighbor that we will be supporting just in case,
that's what we're going to have to do.
Exactly.
And that there's going to build up community spirit.
Exactly, because people lost that social connection. The people in many cases don't know who the neighbor is. And is that neighbor okay? Is that neighbor needs any help or support? And now in face of this, something is changing. And always in every disease, in every condition, there is a moment when you can look into that and understand actually that brought all family together. Actually, everyone came to support me. Without asking or without, begging. We had a time to sit down. We had a time to remember good things that happened in the past, and you have a time to actually, to say thank you to everyone, and that is the really lost in that busy running, trying to catch up with the work, with, with the life.
Paying bills.
paying bills, exactly.
I'm old enough to remember the Ulster workers' strike here many years ago. You know, it was the same then. You had problem getting certain foods and different things, and shops, everything was shut. But it did build up a certain community spirit after, because that was the very first time I had seen a barbecue. Ever, you know, it was during the workers' strike.
Yeah.
And everybody started barbecuing, and they started barbecuing out in the footpath and inviting people over for a wee sausage or a bap or whatever. And, you know, it did build a community spirit. You know, I can see that happen here. Everyone I meet is talking about helping their neighbour.
Yeah.
You know, helping. And, you know, and that's beautiful.
Exactly.
You know, that's the way we should be. And we should be all the time. But maybe out of this, some good will come out of it.
There will be good things, and unfortunately there will be casualties, and that's, you know, if that is...
650,000 casualties last year, nothing came out of it.
I know, but
you know, there is casualties and some comes out of it.
Exactly.
So
Reset,
you know,
every you know, health program is screaming and screaming that cancer numbers are crazy, creeping up. You know, mental health is
shocking.
Alzheimer is hitting, you know, like increasing 10 times in last 10 years, you know, but everyone is thinking that this will not touch them. Mm-hmm. Now with this virus, everyone is scared because that can touch them.
Yeah.
Because no matter how many, you know, kind of cancer kind of is not, it's not contagious.
Yeah.
You know, mental disease is not contagious, and it means you kind of feel safe because, you know, now, you know, with virus,
everybody's
actually
a target.
Everyone can be targeted, you know, so that physically now made everyone to think, you know, actually, you know, that can affect me, you know, but the same, any disease can affect you.
Yeah.
And, you know, it all depends how you behave, what you eat, how you sleep, what you think.
Mm-hmm.
You know, because every morning when you wake up, you have a choice to be miserable or to be happy and to be, you know, open for this new day.
I've actually found that out a few years ago, this happy thing. I was in this place and I just said to myself, fuck it. And what I did was every morning I get up, and the first thing I did is stood up and said, I am happy.
Yes.
And I sat and I thought about the day before I'd done anything, and I thought about all the good things. I wasn't going over any negative things. I thought of all the good things that had happened the day before, and I thought about the day ahead and the good things, you know, the people that they meet and the good things that they do that day. And it's very important. It's very important to keep your head in the right place, because if it goes, there's nothing left.
Yes.
One other thing is 4 states in America, Maryland, the feelers, Venezuela, and now Ireland looks like it might be going next. They have went for a forced vaccination scheme where if you don't get the vaccinations and you haven't a full vaccination card, well, I'm afraid you're not allowed a passport, you're not allowed a driving license, you're not allowed to work. Now, this could be our future.
Could be.
You know, when Ireland's pushing for it, they've called for mandatory. Was it Denmark, I think, it did? Is it Danish? Forced vaccination. They've went for that today. Which is strange for Denmark.
That's what fear does, you know, and...
But this, you know, the forced vaccination things, that's one thing that really worries me. Because I don't have vaccinations. I will not have vaccinations. My dog doesn't get vaccinated. You know what I mean? Barney's as fit as Butcher's dog. But, you know, there's an awful lot of people are concerned about this forced vaccination thing.
Yes, and as anything forced makes people to think, should make people to think, why?
Yeah.
You know, is it right? Mm-hmm. What is science behind why, you know, I, as a healthy person, need to go through that? Yeah. And more discussions are happening, you know, what are vaccinations, how they work, and what are benefits of them, and what are, you know, disadvantages or possible side effects. And so far, vaccinations were done as something you must accept, as a, you are told and you need to do it. But vaccination should be the same process going through consent. They should explain you why they are doing, what are risks, what are possible benefits. And you should have a right to decide.
Yeah.
As for any procedure under NHS or any modern medical situation, you must give your permission for that. And if they will create a proper explanation, which is called patient information leaflet, with everything about disease, everything about how vaccine was made, everything about safety of that vaccine, on how many patients it was tested, what results, if everything will be on that patient information leaflet, and if that benefit of the whole explanation outweighs possible side effects, then it's up to patient to decide. Is he willing to take this or not? But forced vaccinations doesn't sound right.
No.
And of
No,
course,
I will never.
exactly.
You'll have to tie me down.
And in worst scenario, you will need, and I will need to change the country.
Yeah. Well,
And find the country where it's not, there is no forced vaccinations. So that could be a reality. And
the vaccination thing, I'm really against it, because everything I've researched shows me that they're just flying with the wind with this. I was looking at some figures the other day, and it was showing you somebody in their 40s now, so in their lifetime, as a young person, they had on average about 11 vaccinations. And at that time, when they were having 11 vaccinations, the figures for children with problems like ADHD, autism, different things like that, was 11%. Now children are getting 54 vaccinations in the States. And the figures for children with ADHD and autism and these other things is 54%.
exactly.
One correlates lovely with the other. And this all started in 86. That's when Bernie Sanders, who's running for president, gave the pharmaceutical companies a buy ball so as you couldn't then sue
Yes.
the pharmaceutical companies. Now, to me, that's crazy. How can you set up a company there that does what they do and have absolutely no responsibility at all?
Exactly.
It's ridiculous.
So,
and also I found out was up until 86, they'd done double-blind tests where they would have done some, they vaccinated some people, other people weren't vaccinated. Nobody knew who was vaccinated except, and then they were studied. Then that vaccine was given, say to 40 people. Then it was given to, say, 100 people. Then it was given to 1,000 people. Everybody's monitored, checked, double-blind experiment. Some gets it, some don't. And to say, that was all done away with in 86. So now what they're doing is they're making a vaccination and they're putting it on the market and it's never been tested.
So you're right, Tom. There are so many questions about how they make it, why they are, why can't you sue the company who makes vaccines? What is even science behind, because our natural immunity is built when we either breathe in something or we swallow something, but never through the jab or, So natural immune response, which happens through the life, is when we get in contact with virus or bacteria or anything, any pathogen, when we touch it, breathe in or swallow.
Yeah.
So, and some vaccines for kids are developed that way.
Yeah.
And
up our nose and all sorts.
Exactly. And it makes sense, that this way, possibly you can develop natural immune response. But when something is injected in you, and it's not right from initial point, and you're right that when there was more control, when there was whole vaccination schedule not as heavy, not as crazy, there were definitely less autism, ADHD, and all these mental development issues. And brilliant documentary was done by Ty Bollinger with his wife called, Truth About Vaccinations. It's, I think, 9 series about whole vaccine story, how it started, how it was developed, about all players in that, and someone who wants to understand a little bit more, they can just watch it free on YouTube. They just need to put Truth About Vaccines, Ty Bollinger, and it is a resource that is available for everyone. And just to see and understand why there is a big group of people who are really against vaccines. But it's not about against or for vaccines. It's about how they made, what is the science behind, and what is effectiveness and safety. Yes, and safety. If all these things are matched, and if these all parameters are more beneficial to patient, then patient can make his mind, but not as forced thing, because you need to have proper informed consent for something that's injected in you. Everything that pharma is making, they always base the decisions or why they promote that based on clinical trials. So if clinical trial is a golden standard, which looks like at this moment approved as a golden standard to make a decision, is that beneficial or not, we should be able, and we can Google and find, studies that being done for each medical product at the same time for vaccine. So key point is that a lot of people are taking information that someone is telling, or the company that is making is telling that this is like that, without looking into actual papers, which are all available. So that's why more and more pediatricians, more and more the doctors who actually give vaccinations, they can see that something is not right with them, especially when they combine so many vaccines into one syringe. And, when something you're told matches reality, nobody raises questions. Now, because the doctors find that what they are told about vaccines no longer matches actual reality, they start digging, they start looking into what's happening. And that's how they found that in these vaccines, in 1990s, they put mercury and aluminum, and all these babies were physically infused with the heavy metals. So that what caused all these mental conditions. The key point is that because we have internet, we can Google, we can do our own research, and everyone has right to base their own decisions on available information. So if the governments will start imposing something that's against, your understanding, you always have a choice in worst scenario to change country. That's my point. If you can't go against government, but if that will make a possibility of 56% your child getting to becoming autist, you have a choice to think about it, what you do about it. So key point is that there will be people who will go along what government directive is, based on fact that government saying, oh, it's all safe, it's all good, keep going. And or if you are worried, if you have evidence and research showing that you can harm your kid, you will.
And see, my issue is that I don't trust government too much. Government told me DDT was okay, asbestos was okay, smoking was okay. Told me a lot of things was okay, until it gets to a stage that you know it's not okay yourself.
Exactly.
And once people, and then the government will back down. But until then, to me, it's just business.
Yes, exactly. So a lot of things are driven by money.
Yeah.
And therefore, everyone needs to do its own research, and figure out what information is available and why we have so many people against vaccines.
Yeah.
So there is never, fire without, fuel.
Fuel.
Exactly.
Yeah. Listen, that was fascinating, Doctor. Is there anything you just like to say at the end on to give people a wee bit of encouragement?
Absolutely. We are built as quite intellectual species. We have
some of us.
We have innate capacity of, live and kind of function even in that toxic environment. As any animal, we adapt to whatever toxicities are happening around us. Some adapt better, some adapt not as well. And but body wants to live and wants to be healthy. We need to support it with right food, right, a little bit of exercise, little bit of fasting, little bit of pure water and positive thinking, and you can get your body working back optimally and supporting you, your goals, your dreams, and your family, So there is always light. And my most popular medicine at this moment is hopium, which you can take as many times per day as you need.
He said hopium. Okay?
Exactly.
Will pillars come in the door?
Exactly. Hope. Never lose the hope. And take it as a hopium, as many times per day as you need.
Brilliant. Thank you very much.
Welcome, Tom. Thank you. Thanks for inviting. Yes. Exactly. We're hugging.
Yeah, fuck it, coronavirus. Anyway, so it's not all dark and gloom and the end of the world. In fact, I feel very hopeful about a lot of things in this. I really do. I feel hopeful that people are pulling together. I feel hopeful in this sort of like this spirit of people when they're under pressure. Hopefully people will keep an eye on the old people beside them. And anybody that's, needs a bit of a hand, make a drop of extra soup, make a drop of extra stew, drop it into some neighbours, stick it in the freezer in case somebody's hungry, wraps the door in a few weeks.
Yeah.
And, just keep your head up. I don't see us as,
Yeah.
It is what it is.
Exactly.
There's no point as all sitting panicking and
because
get on with life.
Exactly. You need to, now we have a little bit extra time, to spend time with the family.
Yes.
To read a book or two, Do yoga and clean the house.
Meditate.
Exactly.
My house is spotless. It's never been this clean. Frick all else to do himself.
But again, it's time to put something on eBay that you're no longer using, maybe someone needs it, and let's stop buying things and and buying that toilet paper, In a worse scenario, you can wash it.
Yeah, of course you can. Give it away with your hand, wash your hand.
It is.
It's scary.
Yes. But
I'm not worried about myself. I'm worrying about my children, my grandchildren. My parents are well long gone. And people around me, friends, maybe get a wee ailment or something, and keep an eye.
Exactly. Yeah. But exactly, we need to go through that and in the best positive way.
Exactly.
And you can see from the statistics already, I don't remember, but I think yesterday, we already have nearly 100,000 people who survived coronavirus. Yeah. And nobody's focusing on that number.
No, I know that, I know.
So who completely recovered from it, Yeah. So they were tested and confirmed that they got coronavirus, and they now completely, back to normal. So body is capable to deal with it. you need to have a little bit hope.
Yeah. Well,
and believe.
There's a thing going about on the internet at the minute, Anon, QAnon, if anybody's interested. Have a look. Basically what it's saying, that this is all like a reset. I don't know, honest to God, that, you know, that all sorts of people are going to be arrested and put. I would love that to be true. I really would. I'd love a nice, clean wee world to start with.
Exactly.
With good people running it, with good intentions.
Yeah, exactly.
And
Supporting
maybe that's
people.
what we'll get.
Hopefully, exactly. Let's put that mind on, our perspective,
That'll do.
Perfect. Thanks, Tom.
Thank you very much, Doctor. Night, everyone.